me get into the report. During the investigation, 4 themes emerged in this report. The first was the complaint itself that I received. And I characterized it as follows. The complaint was very important and very unique in the Eastern Cape Department of Health. This was the first complaint lodged by a senior health professional consultant psychiatrist, a senior medical scientist, against his employer, the Eastern Cape Health Department and Tower Hospital. The complaint, I described it as coy and complex. And in this word coy, I didn't mean the coy of when you propose a young lady. I meant the coy of being subtle and sometimes evasive in its description of what was being complained about. Of course, Dr. Sukeri, who was the complainant, made the following points that I wish to quote. He had been fighting for 12 years. This was certainly longer than his employment, obviously, at Tower, which was only about 18 months or 2 years at the time. When I asked him about the recommendations, what he would like to see, his recommendations were more about the system rather than about the hospital, the Tower Hospital that he had complained about. He admitted that he had lost his cool and he went to the media to exaggerate his complaint. He did no longer care, which is inimical with the profession of caring. He was aware that he had violated his professional and contractual obligations, but he no longer cared. Dr. Sukeri's complaint was obviously supported in other ways by other doctors, Dr. Mo Nagdi. Insightful, I think, email about the problems of the Eastern Cape, whose, I think, email I have put as an annexure in the document. But basically that there was widespread unhappiness amongst professional staff within the Eastern Cape. And there were other support, I think, for Dr. Sukeri's complaint. There was little evidence or substantiated evidence of institutionalized human rights violations as compared to few and isolated incidents of professional misconducts that I list in the report. I think there was a confusion, I think even within the media, of professional misconducts with human rights abuse, and they were conflated, and I've tried to separate this because they are distinct and they require different pathways to be dealt with within the health profession. I think the second feature of this complaint was that every witness blamed the Eastern Cape Health Department of Health. Every. I interviewed 34 of them within 36 with 36 interviews, and I did not find people who did not actually say something that was wrong within the department. And then I think there was another chorus that said that the management, I suppose, at the hospital was in disarray and obviously engaged in a crusade or a power struggle for change. That is what was occupying them all the time, and that's what irritated and frustrated Dr. Sukeri, and that's what allowed him to go to the media and do what he does. But I'll spell that out. Then there was the complaining Dr. Sukeri, which was the fourth issue. Dr. Sukeri holds a degree, MBCHBA, like all of us who are medical doctors. He is a fellow of the College of Psychiatry of South Africa, like most of you who are psychiatrists. He holds a PhD from Walter Sisulu. I went into his research gate, which is a metrics analysis to see how doctors perform by their peers. His articles, I think there are, the recent one, there are 18 citations. I went into his age index. I think for those of you who want to know, the age index measures the productivity and the citation index of a scientist. If you want to claim that you are a scientist, that's what other scientists will measure without you, because it's all on the internet. There was no recording for Dr. Sukeri on this issue of the H index. However, Dr. Sukeri released unverified, false and exaggerated and damaging death statistics into the media to the public. He violated his professional oath and his employer's confidentiality contractual clauses. And every witness said no amount of anger or frustration could be an excuse for a senior professional to behave this way and violate his professional and contractual oath, ethics and codes of practice. Everybody disagreed totally with the manner and ways in which Dr. Sukeri raised his complaint and went about it. In the process, he irretrievably broke all trust and confidence with his colleagues, both at Tower Hospital. In the Eastern Cape province, nobody wants to work with him anymore because they don't trust him. Now, let me come to my major findings. I can see that most of you are sleeping or getting depressed. You're going to wake up. Now, let me come to the major findings. First of all, the first major finding is that I could find no prima facie evidence of institutionalized, systemic, or deliberate violations of human rights by staff at Tower Psychiatric Hospital and Psychosocial Rehabilitation Center. I could find none of this. The institutionalized, systemic, deliberate violation of human rights, I could not find that. And I want that to be remembered. There were none. There was one that everybody agreed upon, everybody, including Checkpoint. They showed this so-called the seclusion room, which I think is a relic that came with the building of the hospital in 1894 and continued to be the practice there, but it's only practiced by a few. So save for that, I identified a number of, as I say, professional misconducts that I list in the report rather than abuse of human rights. Again, there were no other degrading and inhuman treatments observed or found as alleged by Dr. Sukeri. This finding was corroborated by evidence from the Office of Health Standards Compliance Investigators, the Mental Health Review Board of the Eastern Cape Central Region, the Eastern Cape Technical Task Team, and evidence from the research that I had done and all the 34 witnesses that I interviewed. So Dr. Sukeri's COI complaint was primarily about chronic systemic failures and neglect of the Eastern Cape on mental health care services, with pernicious systemic effects and power struggles for change, what I call a crusade for change. It was not about human rights violations because primarily, as initially alleged and peddled in the media. I want to emphasize that. The primary complaint was coy, deceptive, and it was not about human rights. It was about systemic failures of health services to mental health people in the Eastern Cape. However, Dr. Sukeri, like a highly trusted scientist, failed to conduct basic things, to conduct credible studies, research, or audits with rigorous verifications as the basic requirements of any scientist, data or figures available before making these false and damaging pronouncements to the public through the media. This was a grave error on his part. Here is the first finding that around which everything revolves, and again I want you to remember it. Over an 8-year period, 68 mental health patients died at the hospital. 8-year period, 68. I don't know how many of you have ever visited a hospital and you ask yourself, over an 8-year period, if you have 68 deaths, what would you say about them? This is a 400-bedded hospital that has 68 patients die over an 8-year period. That translates to about 8.5 patients a year in a 400-bedded hospital. However, I think the media did not actually capture this period of death. So, what did they say? They said 90 patients had died. Now, you remember when I released my report on the 1st of February on life esidimeni, it was 94. So what got etched into the public's mind was that, oh, here is another life esidimeni. And this is where the noise that I was talking about of the orchestra started. That because of the closeness of the figure, because of the failure to actually articulate this in terms of a period, something so simple, basic, get translated into a major issue that became a national issue for the wrong basic fact. Now, let me put it into perspective. At life esidimeni, at the end of my investigations, 144 patients had died, which means 12 patients were dying per month. At Tower Hospital, I've just told you about 8.5 patients were dying per year. If you divide that by 12, it translates to 0.71. So there were 0.71 patients dying per month at Tower Hospital compared.
All right, we are going to come out of that particular briefing by the Health Ombud, Professor Malegapuru Makgoba, who basically says in his findings there was, quote unquote, no systemic or institutionalized violation of patients' rights at the Tower Psychiatric Hospital. And he repeated and emphasized that there were none, and he also added that there was no degrading of patients. The only findings that he could find was that, yes, there was chronic systemic failures. And much of it also, I think he focused his attention on Dr. Sukeri, this senior psychiatrist who had raised the alarm and went to the media. And he had very strong words for him, saying that he failed to conduct credible studies, and this was a grave error on his part. And importantly, the issue of death at Tower Hospital, he says that there were 68 patients who died over an 8-year period, and clearly concluding that this you simply cannot compare to the life esidimeni tragedy, which essentially had 144 people die. And he says that you divide that by 12, essentially you had some 12 patients dying per month. And so the Health Ombud clearly making a stark difference between what he found in his investigation at the Tower Psychiatric Hospital. We're going to come out of